Hi, my name is Joyce Bredesen, and I would like to talk with you a little bit about the role of a licensed school nurse. I was a licensed school nurse for about 12 years in both the St. Paul School District and the Elk River School District, and I absolutely loved it. Of course, you have to love working with kids, and I worked mostly in the elementary and the middle schools, which of course has its challenges. I did enjoy each school that I worked in, and what I would like to talk to you about is a little bit about the role that I had when I worked in the Elk River School District. I assisted in overseeing 12 different schools as a licensed school nurse, and so I would go to every school and I would work with and train and delegate the health aides that worked in each of the offices. Do you know, if you have children, if you're in your nursing office, if you actually have a nurse or if you have a health aide? The health aides were wonderful and they were great to work with, and they did a lot of wonderful things for the kids in their buildings. We would work together on planning trainings for the classrooms, such as focusing on diabetes or asthma. We would go in and do hand washing and work with some health issues within the classroom itself. We would put on health fairs within the schools and work together and collaborate with the teachers and with the parents and with their healthcare providers as needed. One of the biggest roles, and I'm sure the role that you probably hear the most, is vision and hearing. That is a form of screening that we would do within the schools and go to every single school. And as we did vision and hearing, we would get volunteers, and our health aides would help, and parents would come in and help, and we would do those screenings annually for each school. And then from that point, we would refer our students who needed further evaluation, we'd refer them on to either their doctors or to make sure that they would get vision checks elsewhere and follow up. We found a lot of kids um, who needed glasses, and it's really important in the schools. If you can't see and can't see the board or can't see what the teacher's writing, it could definitely affect your learning. Also with hearing, your ability to learn. So those are really important in the schools, especially the elementary ages. We also did, I'm just looking at the form to see what I should be touching base with. I did a lot of training of the health aides in regards to, for instance, doing medications such as even rectal diastat for seizures, because some of the schools were a distance away and the ambulance couldn't get there within 10 minutes. And so I would have to delegate the health aides to do some of that work as well. Trach care, tube feedings, there were, it's not just band-aids and hugs, although those are important too. There were a lot of other health issues that our students had. Diabetes was huge, especially with our young kids, the kindergartners and first graders, that they would have insulin pumps, and you would need to work with the students on their insulin pumps and adjusting it and helping them choose what they're going to eat for lunch, for instance, so that they could give themselves the insulin, or you would help them give themselves the insulin that they needed in order to manage the day. And of course, as they grew, these kids who had brittle diabetes would have problems with regulating their diabetes because of their activity levels. So as they get older, their activity levels would increase, and that would definitely mean that they would need to really monitor their diabetes a lot more closely. So we would have, on a regular basis, we would have what's called an IEP meetings individual educational plans for students, and especially students who had significant issues, health issues and otherwise. And as the nurse in the building, or as a licensed school nurse, you would attend those meetings and you would bring in information health related so that as a team looked at what they could do for the student, they would have the information needed regarding their health. And it could be something as such as diabetes or asthma or allergies to peanuts or needing that EpiPen and so forth. So all those would impact how they wrote the individual um, educational plan to some degree. And then as the nurse in the building, we'd also have individual health plans that we developed on every student that had a health issue. So as you can see, in a school of 300, 400 students, you could have easily 50 to 60 individual health plans on those students. And so it was kept you quite busy, actually. And then we would go into the classrooms and we would work with the teachers and with the students. And sometimes, as a school nurse, I would go into the families' homes and I would see, for instance, how they did their tube feedings with their student or with their child, because I would need to be able to do that in the school setting. And so it was much more beneficial to get the family's perspective and utilize their skill level with working with their own child. So, and you develop that rapport with the family, which was very, very helpful as well. And again, that was one of the things I really loved, is that you actually get to work with very closely with each student and with the families, especially of those students who have some health issues and need some follow-up and care. So on a regular basis, the students that you would see in the morning, they would come in and you would give medications. You would go into the classrooms and check on how kids are doing in the classrooms. You would work with the teachers. And again, you would follow up with parents calling. There was always children who were sick. So you would need to follow up to see why those children were missing school and if there was something you needed to do or to pass on to the teachers in the classrooms as well. Um, for instance, let's see, what does it, well, head lice was huge, right, in the schools, and that was always an issue. But if, as a school nurse, I would pick head lice, I would work with the families, I would even go into their homes and help them with trying to get rid of the head lice. And it was a challenge. It was a challenge because so many families are so focused on surviving. There are many families, especially in some districts, and with a lot of high needs and at risk and vulnerable, and not having the financial resources to be able to manage, for instance, just taking care of head lice. So in many of the school districts, there are 50% to 70% of the students who receive free and reduced lunches. So we work with a lot of vulnerable populations and a lot of lower income families who do not have the financial resources, again, that might be needed to help them, for instance, for vision and hearing. If the students need glasses, the family couldn't afford them. So we would, as a nurse, we would find resources to help with purchasing their glasses so that they could be in the classroom and be able to see, or even hearing aids if they needed those, and a lot of other issues that came up. As a licensed school nurse, you were a strong advocate for our students. We collaborated closely with teachers and parents and healthcare providers outside of the school system. We also worked closely with the social worker in the schools. And when we had students who needed things or were really struggling, um, calling in the social worker to help work with those students was really important. So a lot of collaboration happens within the school setting. Um, let's see, some of the interventions from the intervention wheel that have been utilized or are utilized within the school is, first of all, surveillance, monitoring for any kind of diseases or illnesses, and that is a big role that you do as a school nurse. Um, Disease and health event investigation, um, chickenpox, for instance. Where is the student who has the chickenpox, and where have they been, and um, how is that affecting other students in the school and in their classroom, and what do we need to do about it? Um, Outreach is big in regards to vaccinations, and as a nurse, you do a lot of work with vaccinations. Um, State law says that all students coming into the school district need to be up to date on their vaccinations. Now, it's an important role, and we're seeing less families that are agreeing to having their children vaccinated, so they sign off um, on not needing to have those vaccinations. Um, but you do a lot of work with vaccinations. You give vaccinations in some schools, not every school. A lot of times they'll bring in other outside organizations or agencies to come in and give vaccinations within the school setting. Again, for screening, we do a lot of vision and hearing. That's a really big part of school nursing for sure. Case finding, again, the chicken pox is an example. Um, you know, Strep throat and so forth. There's a lot of different areas that you can do some case finding in regards to that. Again, referral and follow-ups. Really, vision and hearing is a great example of referrals and follow-up regarding that. Again, talking to the parents and connecting with any healthcare providers in order to get the services and resources that those children need. Um, as a school nurse, especially when I was overseeing the 12 different schools, delegating was a big role. Um, I ended up calling the Board of Nursing frequently because I wanted to make sure that I was following policy and guidelines. And you delegate, as I said, cathing procedures. Um, we had a little girl, she was 3 years old, in a daycare setting, and the school district is responsible for children from birth to 21. And so, even in the daycare setting, I would have to go into the daycare setting and cath her a couple times a day. And then I trained a couple different people to do it as well. So the role is just so diversified and so overwhelming at times for sure. But that student I followed for 5 years. I also had another student who we did trach care on, suctioning and so forth. And I had to train healthcare providers or our health aides to do some of those services because the schools were 12 miles apart and I couldn't be at every school all the time for sure. So delegation was a big role for me as a licensed school nurse for sure. Um, Health teaching, again, we go into the classrooms, and that was what I loved, is being able to work with the kids. We'd do health fairs, we would just bring in a lot of good information, healthy food choices and so forth, and um, you could have a lot of fun with that. But it was busy. Our days were very busy. Um, Counseling, again, connecting the students with our social worker was really beneficial. And of course, as a school nurse, you do end up doing some counseling, but also mostly listening and outreach to parents and um, other healthcare providers to assist those students when they're really struggling. In the middle school, I found to have quite a few kids who really needed some strong support. And sometimes for them, the safe place was the schools. And so they would come to school because they got to eat and they had a great support system in the school setting. And so I actually found that I just love the middle school kids. They're just struggling with who they are and how to move forward. And well, you probably know those teen years are really challenging. So it was working with middle schools was really fun. Again, community work, we would set up health fairs, bring in outside resources to come into the schools and talk to the kids, for instance, about drugs and um, healthy choices, smoking, and so forth. It always seemed to work best if we'd bring in outside people to come and talk, especially someone closer to their age. And it seemed like the students were much more receptive to that, and it worked really well. And it was really nice to have outside resources to be able to utilize for teaching, health teaching, and so forth. Again, advocacy is a really strong part. Your role is really important in school nursing. You need to really be a strong advocate for your students because lots happening in their lives. For many, again, we work with a high at-risk population, and they need a lot of resources and services, and sometimes just a lot of really good support. Um, so it's important that we do that. So the mission, I'm going to just jump around a little bit here. I'm sorry, but the mission for instance, for the St. Paul Public Schools was for nursing to promote student and staff well-being and enhance educational achievement by removing health-related barriers for learning. And I think that's a great mission. And most schools really focus on how can we remove those barriers to positive health for for our students. I just saw a bunny jump into our garden. I think they're building a bunny nest. So, how do we serve the at-risk population, and what does that mean? So, the St. Paul School District serves a diverse at-risk population, including students who are homeless. I've seen and worked with quite a few students who are struggling with homelessness, struggling with disabilities of various kinds, facing economic hardship, low socioeconomic situations and status, and language barriers. You know, we see a lot of kids coming from different parts of the world, and language is a concern. And a struggle. And I can tell you that in the St. Paul school districts, we didn't have um, enough people who could translate in different languages, and that was a struggle. And as a school nurse, it was looking for resources. Um, and of course, utilizing the resources that the school districts had in regards to language interpreters and so forth. And I utilized them, and it was helpful. But the sad part is that they weren't available all the time. So when a student came in and they didn't speak English very well or could understand it very well, that communication was certainly a barrier to helping those students, because again, I could call an interpreter, but if they're not available at that moment, it didn't help. So that was a struggle for sure. um, so specifically then, the population would include students living in unstable housing, lots of unstable housing, um, different situations with housing, those students who have developmental delays, and sometimes I would even help with reading and schoolwork, because they would come down to the nurse's office and they wouldn't feel good, but they couldn't go home because their parents weren't home and couldn't leave work. So they ended up spending quite a bit of time in the nurse's office. And so I would work with them when I had an opportunity to do so, to work on some of their schoolwork. So again, the school nurse position and role is so diverse. It's a mini emergency room, broken arms, head injuries, fights, gunshot wounds. I had to deal with a gunshot wound and a lot of violence in the middle schools. A lot of kids would come in because there would be initiations for gangs, and they would come in with cigarette burns on their hands, and yeah, you see a wide range of different different things that happen in the school setting. Again, it's a mini emergency room and you're out there on your own. Again, 911 is your backup. And I did call 911 multiple times for different things, for seizures, for serious injuries. Head injuries was a big deal. Bee stings. And, if you don't have an EpiPen for some of these students who have severe allergies, peanut allergies and so forth, you have to call 911. So there's a lot. There's a lot of different things that you need to be on top of. Certainly do your research, keep up to date, and you need to work with evidence-based practice for sure. And that means continuing to look at the research and see what might be beneficial for you as a school nurse, and to be able to utilize some of that research to help you to be a better school nurse. So research is important, and being evidence-based focused. Again, like I said, I called I called the Board of Nursing multiple times because I wasn't quite sure of certain policies or regulations, and so I needed some help with follow through in regards to that. So the Board of Nursing was very helpful. And I got to know people on a first name basis because I called them frequently. So let's talk a few minutes about the levels of prevention. Primary, so in school nursing, again, primary intervention is doing something before anything happens. So vaccinations is primary, a great example of primary prevention, because when you vaccinate, hopefully you'll prevent that disease from ever occurring in the first place. And then you can move on to secondary, which is screenings. An example is, again, the vision and hearing screenings, catching the kids who have the issues or the concerns so that you can then help them so that they can learn better and in that setting, in the school setting. So it's important to do those screenings. And then tertiary, well, monitoring students who have diabetes, for instance. That's an ongoing daily activity, giving medications for different kinds of health issues and so forth. So as a licensed school nurse, you're dealing with all three levels of prevention. And again, you're dealing with from Band-Aids and sometimes just extra support, sometimes truly giving kids a hug. And sending them back to their class, but you're dealing with also medications for different kinds of diseases or illnesses, and asthma, inhalers, um, and then diabetes with insulin and so forth. So you're working with that, and then they go out in the playground and they have accidents. Again, you're working sometimes with broken bones, which actually happens quite frequently, especially falling off the monkey bars. Either it's the clavicle or, yeah, usually the clavicle. But broken bones, head injuries is also a big issue and big concern. So, from that to tube feedings and to cathing and to trach care and to, the list could go on and on and on. So again, you have a lot of autonomy as a school nurse. It's an awesome role, and I hope you get a chance to experience it. Again, it's a specialty area in public health nursing, and I hope that the information that I've given you at least will give you a good start on the paperwork that you need to complete for the course. Also, just make sure that you follow up with some of the resources that are on the site in regards to the role of a licensed school nurse. Also, just the role of a public health nurse, because there are different areas that you can work as a public health nurse. And so I hope that this has been helpful to you, and I look forward to seeing you someday maybe, and good luck as you continue in your nursing career. Thank you.